Hello friends, welcome to the Pathology Insights, and today I'll be discussing about the etiopathogenesis of the breast carcinoma in this video. So this is the breast carcinoma is the second most common cause of the cancer death in the women, first being the lung cancer, and the incidence is also high. It's about 1.7 million women per year are affected by this breast carcinoma, and 3 of the women who develop the breast carcinoma, 1 of them die of this disease. And as the age increases, the incidence or the risk of developing the breast carcinoma increases, and incidence is more in the elderly age group, and it's very rare in the younger females who are younger than the 25 years of the age. Now coming to the risk factors, we have a list of the risk factors, out of which most of the risk factors they are associated with the estrogen exposure. So this estrogen exposure causes the proliferation of the ductal epithelial cells, which increases the risk. So most of them in this list they are associated with the increase in the estrogen exposure, whereas a few of them are because of the mutations. Now we'll see the individual one. The first one is the female gender. So when we compare the males and the females, obviously the females have increased estrogen level, that increases the risk. And increased age group, so as the age increases, number of years the females are exposed, the breast tissue is exposed to the estrogen, it increases. So the number of years estrogen exposure increases, the risk of the malignancy increases. Then high dose of radiation to the chest at the younger age group. In this, what happens is during the younger age group, when there is exposure to the radiation, the DNA of the cells may get damaged, and during the puberty and the later in the life, when these cells are proliferating, the cells with the damaged DNA they proliferate, and that leads to the neoplastic change in the cell, and the patient may develop the malignancies. And the genetic mutations, we have certain germline mutations and the sporadic mutations also that leads to the development of the breast carcinomas. And the family history, the first degree relatives, they have increased risk of developing breast malignancies because some of the these mutations they are inherited. So when the patient has a family history, so she has an increased risk because that can be because of the inherited mutated genes. Then increased breast density is one of the cause. Then early menarche and the late menopause. In both the conditions, the number of years the patient has the hormonal exposure increases. If the periods start early, then her hormonal exposure, breast tissue exposure to the hormones increases. So number of years she has the periods, that many years she will be having the hormonal effect. So either it's because of early menarche or the late menopause, both of them will increase the exposure to the estrogen, that increases the risk. Then the late first pregnancy and nulliparity and absence of breastfeeding. Now these if the patient has absence of the pregnancy, what happens during the pregnancy or during the lactation is the level of the estrogen will fall and progesterone will increase. So progesterone will be counteracting the effect of the estrogen, so it has some protective effect. But if the patient doesn't have the pregnancy, or she has a late first pregnancy, or she has a nulliparity or absence of the breastfeeding, that protective effect will not be there and she has increased risk of developing the breast carcinomas. Then you have exogenous hormonal replacement therapy. This most of the postmenopausal women nowadays they are using the estrogen pills, so that increases the risk. If you have a combination pills, estrogen progesterone, that may not increase the risk, but only estrogen pills, they may increase the risk for development of the breast malignancies. Then the physical inactivity that leads to obesity and high alcohol consumption. Both these conditions they affect the metabolism of the estrogen. So in both these conditions you have increased estradiol levels, that again increases the risk for the development of the breast carcinomas. So in this way we have a list of the risk factors. Now I just made a few words to remember easily this one, that farm had a firm MPN. It looks very odd, this sentence, but I feel that it might be easy to list out these risk factors. F stands for the female gender, A stands for the age, R is for radiation, M for mutation, H is for the history, family history, A is for the alcohol consumption, D stands for density, F is for the breastfeeding, I is for inactivity, R stands for replacement therapy, and two M's, they stand for the early menarche and late menopause. P stands for the late first pregnancy, and N is for nulliparity. So in this way, all the risk factors are covered here. So if you remember these few words, you can memorize these risk factors. Now, as I told you, the estrogen is the one which increases the risk. How it increases is the estrogen stimulates the duct cell proliferation. Now, when you see a normal ductal epithelial cell, we have the estrogen receptors which are present in the nucleus. Now, in the other cells, even the estrogen receptors, they are present on the membrane also, but in the ductal epithelial cells, the estrogen receptors which are present in the nucleus are very important. Now, the estrogen hormone in the circulation, it enters into the this ductal epithelial cells, and from the cytoplasm, it comes and attaches to the receptors which are present in the nucleus. So once this complex is formed, that is estrogen and the estrogen receptor complex, it combines with the transcription factors which are on the DNA. Once this complex binds to the DNA, there is increased expression of the genes that leads to the production of the proteins which will be triggering the cell proliferation. Okay, so the complex combines to the DNA, causes the increased expression of the genes that produce the proteins which are responsible for the cell proliferation, and immediately this ductal epithelial cell, it starts proliferating and producing the new cells. Now, how this causes the malignancy is, when the cells are proliferating, initially if you have a damaged DNA in the cell, then there are certain checkpoints in the cell cycle, and during these checkpoints, they stop the cell with the damaged DNA to further proceed in the proliferating cell cycle. So they stop the cell there and they give some time for the cell to repair its DNA. Now once the cell repairs its DNA, then again it enters into the proliferating cell cycle and starts proliferating. Now if it cannot repair its DNA, then these checkpoint proteins, they stimulate the process of the apoptosis, so that the cell with the damaged DNA, it undergoes the apoptosis and dies off. Now what happens when the cells are proliferating fastly is they skip these checkpoints. Once they skip the checkpoints, the cell with the damaged DNA, it enters into the cell cycle with the damaged DNA itself, and it starts proliferating. And when it is proliferating with the damaged DNA, there is always a risk of development of the neoplastic cell from this cell, and then we develop the malignancies. Okay. Now that was because of the estrogen. So another one was, as I told you, we have a genetic causes. So in the genetic causes, we have the mutations. We have two types of the mutations, the germline mutations and the sporadic mutations. So when we see the germline mutations, these are the mutations which are present in the germ cell, and they are inherited. Most these germ cells, the mutations are present in the germ cells, so they are inherited to the offsprings, and they constitute only for the minority of the cases of the breast carcinomas. And the patient who have these mutations, they develop the malignancies at the younger age group. Okay, usually with the germline mutations, they will develop malignancies at the younger age group. Whereas the sporadic mutations, these are the mutations which are present in the cell of the patient itself. These are not inherited from their parents. They develop the mutations in the cells of the patient itself, but later on these mutations may or may not be inherited to their offsprings. Now these are not present in the germ cells. Now these sporadic mutations, they constitute majority of the cases of the breast cancers, and we see them in the breast carcinomas are developed in the older age group in these patients. Now we have a list of the genes in this. So in the germline mutations, we have most of the genes are actually the tumor suppressor genes, and out of this list, the two important ones are the BRCA1 and the BRCA2 genes. Now remaining, we have TP53, PTN, PALB2, ATM, CHEK2, CDH1 and STK11 genes. Now most of the genes are associated with some syndromes also, but in the breast malignancies, the most important one are BRCA1 and the BRCA2. When we see the sporadic mutations here, the most common one is the mutation in the P53 gene, TP53 gene, which produces the abnormal P53 protein. Now we'll see the individual genes. Now BRCA1 and BRCA2, as I told you, this is very important in the breast malignancies. What does it do normally? So when the cell has a damaged DNA, and that damage can be either because of extrinsic or the intrinsic factors, like either it can be because of radiations or some changes within the body, within the cell itself, which causes the damage to the DNA. In a normal cell, these BRCA proteins, they combine with other proteins and form a complex. That complex will go and attach to this damaged DNA and starts repairing the damaged DNA. And later on, we have a repair of the DNA, and again we get a normal cell here with the normal DNA. Now if it cannot repair, then these proteins, they will induce the apoptosis. Cell will undergo the apoptosis. This is what happens in the normal cell. But if the cells have the BRCA mutations, then this complex which is formed here, that is along with the BRCA protein, other proteins also form a complex for repairing. So that complex is not formed. When that complex is not formed, the cell will be present with this damaged DNA itself, and it will enter into the cell cycle with this damaged DNA. Then these cells, when they proliferate with the damaged DNA, they can transform into the neoplastic cell, and that leads to the malignancies. So here we have abnormal BRCA protein or absence of BRCA protein, which will prevent the repair of the damaged DNA, that leads to the malignancies. Now what is the difference between BRCA1 and the BRCA2? BRCA1 is present on the chromosome 17 on the long arm at 2'1 region, whereas BRCA2, it is present on the chromosome 13 on the long arm at the region 12.3. Now when you see the differences between them, most of the female breast carcinomas, they are because of the BRCA1. When they can be because of BRCA2 also, but more commonly it is because of the BRCA1. And age also, these are at a younger age group. BRCA1, the patients who are having these mutations, they develop malignancies at somewhat younger age group when compared to the patient with the mutations of BRCA2. And as I told you, the male breast carcinomas, the females, it is BRCA1, whereas in the males, the breast carcinomas are mostly because of the BRCA2. Okay, then when we come to the other malignancies which can develop in these patients, the BRCA1 patients, they have more chances of developing ovarian malignancies, whereas the patients with the BRCA2, they have more chances of developing pancreatic carcinomas and prostatic carcinomas. Even these patients also can develop, but the chances of developing the other carcinomas are less. Most commonly they develop ovarian, whereas the BRCA2, they develop prostatic and pancreatic. Okay, that's the difference. So just to remember, BRCA1 is FBO, that is female breast carcinomas and ovarian carcinomas, more common, whereas BRCA2, it is MBPs, male breast carcinomas, and 2Ps, which stands for pancreatic and prostatic carcinomas. Now, as I told you, we have many genes are present along with BRCA1 and BRCA2. The first one is the TP53 gene. Now this produces a tumor suppressor protein. This tumor suppressor protein, it helps to repair the breaks in the DNA, and if it cannot repair, it activates the apoptosis. So obviously mutation in this will produce a protein which cannot help to repair the damaged DNA. Now these mutations we see mostly in the Li-Fraumeni syndrome. So these patients with the Li-Fraumeni syndrome, they have more risk of developing the breast malignancies. Now another one is a PTN gene. Now this PTN gene, it produces phosphatase and tensine enzyme that stops the proliferation of the cell and triggers the apoptosis. So when you have the mutations in this gene, obviously the proliferation will not be stopped, the cells start proliferation and the apoptosis will not occur. So this gene is associated with the syndrome, that is the Cowden syndrome. And the another one is the PALB2 gene. Now this gene produces the protein which combines with the BRCA2 protein. When the BRCA2 protein combines with the protein produced by the PALB2, then only it can repair the damaged DNA. So if you have abnormality in this gene, the protein which is produced by this cannot combine with the BRCA2 and work to repair the DNA. The next one is the ATM gene, what we call it as ataxia telangiectasia mutated gene. Now this gene produces the cell cycle checkpoint kinases, which controls the cell cycle signaling pathways. Now this is associated with ataxia telangiectasia syndrome. Another one is the CDH1 gene. This is responsible for the production of the protein E-catherine. This is also one of the tumor suppressor protein, and this is associated with hereditary diffuse gastric carcinomas. Another one is the CHEK2, that is checkpoint kinase 2 gene. This is involved in the repair of the DNA and the apoptosis. If there is no repair, then it leads to the apoptosis. Now the last one is STK11, that is serine threonine kinase 11 gene. This plays a role in the apoptosis, in the DNA damage, cell metabolism and maintenance of the cell polarity. Now this mutations in this gene is associated with the Peutz-Jeghers syndrome. Now all these genes, they are associated with some syndromes, so patients with that syndromes, they have a risk for development of the malignancies. Just to remember all these genes, a small word, T2 packs. If you remember this, I think you can get all your genes. T stands for TP53, 2 P's means one P is for PTN, another one is for the PALB2, then A is for the ATM gene, C is for the CDH1, another C is for the CHEK2, S is for the STK11. So if you remember this word, again you will get the list of the genes which are responsible for the development of the breast carcinomas. So this is just a summary of the risk factors. So how do they cause? The risk factors, as I told you, the female gender, increasing age, radiation, mutations, then family history, alcohol consumption, breast density, and you have the lack of the breastfeeding, inactivity, physical inactivity, replacement therapy with estrogen, early menopause, early menarche, late menopause, late first pregnancy, nulliparity. So all these are the risk factors. Now these risk factors are either associated with the exposure to the estrogen or with the genetic mutations. So associated with the estrogen exposure, it causes the proliferation, and when we see the genetic mutations, we have germline mutations and the sporadic mutations. So in the germline mutations, we have BRCA1 present on chromosome 17, associated with female breast cancers and ovarian carcinomas, whereas BRCA2 present on the chromosome 13, associated with the male breast carcinomas, prostatic carcinomas and pancreatic carcinomas. And remaining, we have the other genes, that is TP53, PTN gene, PALB2, ATM gene, CHEK2 gene, CDH1 gene and STK11 gene. So the mutations in all these genes are also associated with the breast malignancies. Now in the sporadic, we have most common TP53 gene mutations. Germline mutations, they constitute minority of the cases occurring in the younger age group, whereas the sporadic mutations, they occur in the elderly age group. So this was what we have finished previously. And when we see the mechanism of the development of the breast carcinoma, here we have the environmental factors and the hormonal factors and the genetic factors. So environmental factors like the radiation, they can cause the damage to the DNA and the patient can have abnormal DNA, whereas the hormonal factors, which causes the increase in the estrogen levels, that causes the proliferation of the cells. So both environmental and the hormonal factors coming together, they cause dysregulated cell proliferation. Whereas the genetic factors, mutation in certain genes, which are mostly the tumor suppressor genes, they produce the abnormal proteins which are not useful for repairing the DNA. So in these patients, they will have failure to repair the damaged DNA, and these proteins are also useful for producing the apoptosis. But when there is mutation in these genes, then there is reduced cell death. Apoptosis will not be there and the cells will have prolonged life with the abnormal DNA. So along with this, both these factors like dysregulated cell proliferation and failure to repair the damaged DNA put together, there will be cell proliferation with the damaged DNA itself, with abnormal DNA. And the cells with abnormal DNA, they lead to the neoplasms or the breast malignancies. This is the mechanism of the development of the breast carcinoma. So that finishes the etiopathogenesis of the breast carcinomas, and in my next video I'll be talking about the classification of the breast carcinomas and about the morphology of the breast carcinomas. Thank you, friends.